Thank you for joining us on American Medicine Today. I'm Kimberly Brumell, joined by Ethan Euchre.
Happy to be here.
And world-renowned orthopedic surgeon, Dr. Alfred Bonati of the Bonati Spine Institute.
Hi.
Now, using stitches to treat major wounds hasn't really changed for thousands of years. That is until now, a new device called Top Closure. It's revolutionizing deep wound treatment. And joining us right now from China, of all places, is Dr. Topaz, Chief of Plastic Surgery at Israel's Hillel Yaffe Medical Center and one of the developers of the closure. So thank you for joining us, Dr. Topaz.
Good evening. Nice joining you.
Top Closure is a pretty incredible device. And as you mentioned, Kimberly, suturing really hasn't changed in millennia.
Yes.
So, Dr. Topaz, what made you see a need for improvement, and how did you come about inventing or developing Top Closure?
During my professional training and work in Israel, I have treated a lot of severe trauma injuries, and we have encountered severe road accidents, suicide bombing, and combat injuries that would take long and complicated course of healing. And for years, I knew that we need to find different and better way to solve these wound healing issues. So actually, it's a whole process that took me during the years to think, and I would say it's the same way as an apple drops from a tree to get the idea, and well, this is the best solution to do it.
Just a moment of inspiration, really. And we saw, you all sent us some photos, Dr.
77
Topaz.
pages.
Yeah,
Yes.
and just some of these wounds that are being closed with Top Closure is pretty incredible. Tell us kind of how it works, because it's like it still uses sutures, but it kind of bridges the gap and pulls it together.
Stretching the skin, I take it.
It's complete different thinking, because if you think about sutures, they were all the same, just wires that hold the skin together. And this way of holding the skin creates a high shear stress on the skin, and many times it would create damage to the skin, while what we actually need to do is to hold the skin in a gentle way, and that would be by increasing the size of grip on the skin as the plates of the Top Closure. So that was the main change in thinking, in the idea. So instead of using very narrow sutures, use a wide grip by two fingers holding the wound edges, bringing them together. That is actually the Top Closure.
The thing I couldn't get over is in the pictures that you sent, these are gaping wounds.
They even held up a ruler to, and they're 4, 5, 6 inch wounds.
It doesn't even
just
look
massive.
like with any type of suture that these would ever close. And with your particular product, Top Closure, is it held on by adhesive? I was trying to figure that out, but it gently, slowly stretches the skin.
We attach the plates to the skin, either by glue or by staples or by sutures.
Okay.
But then what connects it is actually tension sutures that goes from one side to the other and grip the whole depth of the wound and bring the two wound edges together on block. So it's not the sutures, it's actually bringing the whole tissue together.
Is this technique something that you use in a progressive way, or you can close in the same time that you are doing the first correction of the wound?
The other great idea about the Top Closure is that you can use it before surgery. We call it biomechanical creep, slowly stretching the skin and bringing the wound together, the skin, stretching the skin together so that we prepare the skin for final closure. Or we can use it during surgery, like expediting, doing stress relaxation, pulling hard and relaxing, and that would very fast bring the wound edges together. And again, we can use it after surgery. If we could not close the wound during surgery, we can slowly stretch the skin after surgery to close it completely later.
I saw in my training in plastic surgery, we used some type of balloons underneath the skin, and then we allowed the balloon to distend the skin for a period of time, and then after that the skin was stretched, and then we brought the skin together. Is some idea like that?
This is what you're talking about, is a tissue expander. But that would take another surgery to place the balloon under the skin, another weeks and even months to inflate and stretch the skin.
Yeah.
While we can do it externally while applying the top closure on the skin and stretching the skin slowly in a non-invasive way and just preparing for surgery so then the skin can be loose and could be approximated much easier.
Okay, great.
Am I correct in the assumption that your product keeps adhesions from forming? Because the other thing I noticed on all the information you had sent over, it shows before and after photos, but it shows people in motion that they still have full range of motion. So is it helping in that healing process to avoid adhesions?
In a way, it does. We prefer to put the top closure as early as possible following trauma, for example. If you wait too long, then scarring is created underneath the flaps or underneath the skin, and then it would be very hard to mobilize the skin. While if you do it early, you can stretch the skin and bring the wound edges together so that you can stretch the skin and close the wound much, much faster. And this we experience in combat injuries, that we can close in a very speedy way and close the wound early to improve functionality, and that's a major importance in wound closure.
Yeah, that's actually one of the biggest advantages of top closure is it can be used on the battlefield, right on the battlefield after a wound has occurred. Now, you've traveled all over the world, Dr. Topaz. I talked to your publicist, or your assistant, for probably an hour before we set this up, and she was telling me some of the amazing things you've done around the world. I mean, you're in China now, you work in Israel. What are some of the more extreme questions, or some of the more extreme cases that you've seen that the top closure has helped with?
I can mention a few cases. One case that we did in Israel was cutting out a huge tumor and being able to close it within 26 minutes. I mean, that was, I would tell you, that was a gap of about 17 centimeters that we could stretch and close the wound in about 26 minutes. Another case that we did in China, that was a huge recurrent sarcoma, a relatively young patient that was operated 5 times before, and the tumor recurred. And we could close it by stress relaxation in 2 hours and 14 minutes. That kind of a defect would commonly be closed by big flaps.
How long do you leave the stay sutures to relax the skin?
I would leave the whole system attached to the skin for about, it depends on the gap, but I would say up to 3 to 4 weeks. But then once you take it out, the wound is healed completely. And the other important thing about it is that the patient can mobilize early. Another case that I did in Panama, we treated a huge skin defect after necrotizing fasciitis. That's a severe infection of the skin that necessitated wide excision of the skin. And she was treated for about 2 months just with vacuum, growing granulation tissue, but then that did not close the wound. And what we did there was applying the top closure together with the vacuum. And that was highly infected wound and closing the wound in a very short time. And the patient could mobilize very early, dancing in about 3 weeks. That's something that we cannot achieve when closing with flaps or skin grafts.
How the body react when you close the skin in somebody who has, for example, an osteomyelitis? Imagine that somebody who has an accident, a motorcycle, expose the bone, and then you close the skin. The idea is fantastic, because sooner you close the skin, faster you correct the possibility of infection. But if you already have an infection and it's an osteo, if you close the skin, is that beneficial, or you need to maintain the skin open?
This is a very good question. Actually, we developed another unique system, which is ROIN-PT. This is combining vacuum, irrigation, and oxygen together. And we apply the antibiotics to the wound. So in these cases of infected wounds, we combine vacuum treatment with irrigation and oxygen together with the top closure. These cases, we will not close the wound completely immediately. We would wait until the infection is eradicated, and only then we can actually close the wound completely. So that will be a different case, that will be unique. But again, this is another topic for the way that we treat infected wounds, which is very unique too.
Thank you for calling us from China, Dr. Morris Topaz, Chief of Plastic Surgery at Israel's Hillel Yafe Medical Center and one of the developers of the closure. Thank you so much for telling us about your product.
Nice talking to you.
Thanks, Dr. Topaz.
Thank you.
All right,
nice
have a good day.
talking to you.
Bye-bye.
Bye-bye.
Thank you. Bye-bye.